Hello friends, myself Dr. Anupian. I am a physician and intensivist. So today I am going to discuss you guys about some case scenario of sarcoidosis. This is a real case scenario. Okay. So a patient of 39-year-old female patient, she resides in Purulia, West Bengal. So she presented with complaints of shortness of breath, on-and off fever, and a long-standing rashes, which was rash was about 8 years old. She was investigating for this. She couldn't able to make any diagnosis, and the fever was there for almost 6 months, and it was a pyrexia of unknown origin. So, in a generalized examination, we could able to find some rashes, which is you can see in the picture of the leg where the rashes was there. So this was the rashes which were there on the upper limbs. Okay, so the rashes was also present in the face, and I can show you that this um is present here in the cheek and the neck area also. So we did a examination of a generalized examination. The patient was conscious oriented. Vitals were almost stable, but the systemic examination showed some hepatomegaly and splenomegaly. Apart from that, the chest she had a wheeze laterally with no murmur. EBG was done, which confirmed that she had some sort of hypoxia, and apart from that, the EBG was normal. So this was the basic blood investigations. So the CBC was currently normal. There was a bit of anemia and thrombocytopenia mild, but it was acceptable. The biochemistry labs showed a raised calcium, serum calcium, but apart from that, other tests were normal. So, considering the patient's um, presentation and the generalized picture, we did a 24-hour urine calcium, which showed a raised result. So we can see here, and the patient had some associated polyuria also because of hypercalcemia. We did a chest X-ray. You can see in the chest X-ray there was some bilateral opacities, which is mainly concentrated in the hilar area. So we call it as bilateral hilar opacities. So you may know that the sarcoidosis can present like a bilateral hilar opacities in the chest X-ray. So we did a spirometry. Spirometry like showed an restrictive lung picture. So you can see here. We did an DLCO. DLCO showed a moderately reduced picture, which was a single breath diffusion test. And the CT scan mediastinal window, you can see bilateral lymph nodes, and this is the bilateral lymphadenopathies. CT scan of the chest, and we did a CT of abdomen also, which shows extensive lymphadenopathy, retroperitoneal areas. So we got bilateral parahilar lymphadenopathies, mediastinal lymphadenopathies, extensive retroperitoneal, bilateral iliac and inguinal nodes, along with the hepatomegaly. We did a EBUS, so which is the endoscopic bronchoscopic ultrasound. So you can see this is the vocal cord, and we are going into the trachea. So you can see the tracheal rings. So we are about to reach the carina. Let's see the tracheal rings. Yeah. Yeah, you can see the carina right now. Left one is the left main bronchus, and the right is the right main bronchus. We are going to the right main bronchus. Let's see, this is the bronchus intermedius, and you can see the special type of bronchus here, and it is somewhat raised appearance. You can see the whole the bronchial mucosa is affected. These all things, all mucosa is raised. These all areas are affected. You can call this as crazy pavement appearance, which is typically seen in the sarcoid lung. So we took a biopsy from these areas. Okay, the biopsy showed non-caseating granulomatous inflammation, which is in favor of sarcoid. And we did biopsy, skin biopsy also from the lesions which I shown before, which also confirmed and consistent with the sarcoidosis. And had complaints of blurring of vision. So MRI brain was done. MRI brain showed you can see multiple ring enhancing lesions here and here. So lesions were present in the right cerebellar hemisphere and the frontal lobe with minimal perilesional edema involving the frontal lobe of the lesion, which is granulomatous in nature. So this is a systemic sarcoid. So the treatment started with the steroids, the drug of choice of sarcoidosis. You can see how the patient changed after 3 months. See all the rashes were gone. See all the neck rashes or the rashes in the cheeks were gone. So this is very interesting case of sarcoidosis which was extensively investigated. And thank you for listening. Please share and subscribe our channel. Thank you.